All right, why don't we look at the camera? I'm Dr. Guard. I'm playing the role of the administrator today.
I'm Lindsay. I'm the nurse/scribe.
Kevin, case manager.
Janisha, physical therapy.
Craig Novak, myself, MD.
Donna Scott, pharmacist.
All right, guys, it's noon. Let's go ahead and get started with MDTRs. Looks like everybody's here.
Okay, we have room 341. Patient's been here for 10 out of 6 days.
This is Mr. Joe Brown, came in with sepsis, transferred out of the ICU last evening, very deconditioned. We'll need barriers, will be final PTO T-Rex, likely we'll need placement as well. IV antibiotics are ongoing as well.
Patient requiring moderate assistance and will benefit from post-acute care, high fall risk, requiring 24/7 supervision.
All right, and then we have sent out some referrals for SNF placement. We did get a bed offer from Riverview, and actually we started a pre-cert yesterday on the 20th. The patient has Medicare Humana, so it'll take a few days.
The patient's on antibiotics that are going to be ending December 31st, Dr. Novak.
I've reached out to ID, we're waiting on some final cultures to determine final antibiotics. I think best case scenario for medical stability will be probably 12/22.
Okay. If you have any problems getting a hold of ID, just let me know. I can help you with that.
Sounds good, appreciate
Okay.
it.
And Dr. Novak, what would be the anticipated date of discharge?
I think 12/22 probably, best case scenario.
Thank you. Next, we have room 255. Patient's been here 7 out of 5 days.
This is Miss Mary Smith, here with a hip fracture after falling at home. Status post-ORIF, post-op day 2. We'll need PTOT, final REX, ortho clearance as well. Those are the barriers for discharge currently.
Looks like this patient's going to require some moderate to maximum assist with mobility. Patient very motivated and would make an excellent candidate for inpatient rehab.
Okay. And actually, we've already got some referrals out for inpatient rehab. We sent a referral to Encompass, and they've accepted the patient. We started a pre-cert on the 19th. This patient's got Medicare, United Healthcare, so we'll take a few days for that pre-cert to come back. There's no family support, so we also sent out SNF referrals as a backup plan.
Good. I like to hear you guys talking about a plan A and a plan B, especially with UHC Medicare, right? There's always a chance that it's not approved, and we need to be thinking about a plan B.
Exactly. Dr. Novak, the patient's not on any current anticoagulation except for baby aspirin, so did you want to go with anything else on the patient?
Yeah, we can go with Lovenox, 40 milligrams Q12.
Okay.
Can we DC tele patient's been normal sinus rhythm for the last 48 hours?
Yeah, patient's stable, no issues with DC utility.
Okay, and then what would be the anticipated date of discharge?
Given ortho clearance, I think best case scenario will probably be the 23rd.
All right. Room 367, patient here for 12 days, 12 out of 7 days.
This is Miss Alice Wonderland, here for a dog bite of left lower leg, resulting in cellulitis, complex wound care, required debridement. Patient will need outpatient wound care. Wound vac will definitely be barriers as well.
Okay, yeah, so this patient has no payer, they're uninsured. And since they need a charity, a wound vac, we're going to have to apply for a charity application. And then also the patient will need outpatient wound care set up at the clinic.
Okay. They live locally, so they can come here to
Yes.
Savannah?
Yeah.
Okay. And was this the patient, Dr. Novak, you were mentioning to me about the white count being high?
Yeah, we do need continued improvement in white blood cell count, goal less than 11 prior to
Okay.
discharge.
Okay, goal of 11 or less. Okay, thank you.
So this patient's not cooperating with therapy due to pain she's having, so we're also going to need to get her a rolling walker at home.
All right, so we'll reach out to the family and see if they can pay for a rolling walker, and if not, then we'll see if we can get that escalated to administration for possible payment.
Dr. Novak, did you want to look at maybe changing the patient's pain medication from something short-acting to long-acting?
Yeah, definitely sounds good. We can schedule it along with therapy, likely go with Oxy, 10 milligrams Q12, and then we can keep the Percocet Q6 hours for breakthrough. And I'll discuss with nursing to schedule that prior to therapy.
Okay.
We removed the patient's folate per the removal protocol, but they're having difficulty voiding. They've been requiring straight cath every 4 to 6 hours.
Okay, I'll add some Flomax and then we can continue the bladder scan moving forward. If we have continued retention, we may have to place fully which patient can be discharged with at that time.
Okay, and then what would be the anticipated date of discharge?
Anticipated date of discharge, let's do 12/24, as patient is needing continued wound care, improvement in weight count, and better pain control.
All right.
All right. Good job. Let's do one more scenario, just so that they know not every patient has to be in this big detail. Let's do a patient that's discharged. So, why don't you just make up a room number, and Craig can say the patient name and say that they're discharged, and then you can ask if there's any barriers from anyone on the team for discharge, and we'll just kind of shake our head no, and that'll be it.
So do I just say like room 422, patient discharging today?
I would
Alright,
say,
let's do like, patient stable for discharge, discharge it, order in, awaiting transport, in case management say transport hasn't been called, scheduled pickup time for like 12.
Yeah. and
That's
that'd
it.
be it. Okay. So say room 388.
In here, 14 out of.
Yeah, yeah.
Okay, I
was
still
gonna
do
say,
that part?
Yeah,
Okay.
say they've been, let's be impressive, they've been here 2 days out of 5.
Yes. Why is everyone oversleep?
Right. You noticed that.
Overstayed their welcome.
Yeah, I'm not doing a great job here.
All right, room 422, patient's been here 2 out of 5 days.
This is Miss Joe Brown. Patient has discharge order in, awaiting transport, discussed with case management earlier.
Yeah, and we've set up transport. We've got, actually, the patient lives out of town, so we've given them a pass, bus pass.
And we've already had the medication prescriptions delivered at the bedside.
Are there any other barriers to discharge? Anything?
Nope.
Oh.